Hi, today we're going to talk about peptides, which is a new therapy that needs to be known by all of you. Peptides are groups of amino acids, most of the times less than 50 amino acids form a so called peptide. The history of peptides started a long time ago when doctors were treating children with less size, for instance, with underdeveloped, and they would treat with some hormones that in reality are peptides. So, along the years, they have been studying these peptides that are the building of bigger proteins called hormones. The most important of them is the growth hormone. Um, Long time ago, we knew that growth hormones have to do with the development of the human body and would stop the production around 20 or 22 years old. Now we know that we produce growth hormone our entire life, but in lesser amount and with less frequency. So a hormone like growth hormone eh, has implications in every single tissue. They help develop bones, muscle, brain, etc. So the researchers started studying pieces of this hormone that are called peptides, and they realized that each one of those pieces would have a different action and function in the body. Nowadays, we have more than 70,000 peptides that are known from different places. That could be natural places or from um, animal tissues. The use of the peptides have been for growth development, for anti-cancer therapies, for pain management, for inflammatory conditions, for people with autoimmune diseases. So everybody is subject to the possibility of being treated with peptides. If a person, for instance, has a long-standing autoimmune diseases, most likely one of the problems is coming from the digestive system. And we do have peptides that can treat certain conditions. On the other hand, the peptides have been very successful in modulating the inflammatory response of our body. So we're using that for people with Alzheimer, for people with Parkinson's disease, people with multiple sclerosis, rheumatoid arthritis, and different diseases where the immune system is reacting against the patient. So, peptides are substances that are used in combination with some other anti-aging products like the hormones for sex hormones or cortisol and along with a good diet, exercise, and sleep pattern. So we have peptides that are good for inflammation. There are some peptides that are good for memory. There are peptides that are good for further development of muscles, uh, weight control, decreasing the amount of fat in the body, and so on and so forth. The majority of these peptides are um, provided in a subcutaneous way, but we do have different ways to treat with peptides. There are some nasal sprays, there are some capsules, there are some creams, and there are some intravenous and also uh, intra fat. So the doctors that are working with this are supposed to be expert in the effects and also in the side effects. Most of the time, the side effect of the some of these peptides are pretty negligible and very transient. some people have just described some a headache that is very uncommon, a little transient nausea with some of the peptides. No side effects are prolonged in the therapy with these medications. And in reality, these are very, very good substances for chronic inflammatory conditions. Even furthermore, we have some peptides that helps in the regeneration of nerves and connections between nerves. And in this regard, they have been used in diseases like Alzheimer and Parkinson and MS. So there are also some peptides that are used in children, especially children with autism. So it is very difficult to say exactly the use of this because it's very extended and is relative to the medical condition that needs to be treated. So if you have been treated with conventional medications and it's not working, it will be important that you search on peptides as one of the new tools to treat your medical condition, whatever it is. If you need further information, you can call the Institute of Regenerative Medicine at 915-490-0647.